January is Cervical Cancer Awareness Month. The American Cancer Society predicts more than 13,000 cases will be diagnosed in women this year. But you can also take several steps to try and prevent it, and that's what we're talking about here today with Dr. Emma Rossi. She is a gynecologic oncologist for Cone Health Cancer Center. Good morning.
Good morning, Cindy.
It's great to see you. I know a little bit about cervical cancer, but so many strides have been made in detection and all in recent years. Am I correct about that?
Absolutely. We obviously have the pap smear, which is sort of the hallmark of early detection for cervical cancer. But in recent years, we've learned a lot more about what actually causes cervical cancer. It's a virus, and we've become very good at detecting the virus, and particularly the high-risk viruses. So we can now detect that as well and really narrow down which women are at highest risk for developing this.
And in doing that, you can take steps in order to prevent it, right?
Exactly. So first of all, we've got a vaccine against the virus. So the number one best way to prevent this is actually for women between the ages of 9 to 45 to be vaccinated against the virus. And so recently there's been an expansion in the age of eligibility for the virus. So previously you may not have realized you were eligible, but now with the expansion in the age range, you can be vaccinated up to age 45. And then all women should undergo pap or viral testing with their OBGYN or primary care provider. And with those testing, we can catch cervical cancer at the precancerous stages or the very early stages where it's much more likely to be curable.
And that is so key to having those yearly pap smears, or making sure that you have that yearly visit with your OBGYN, right?
Absolutely. And sometimes your OBGYN will tell you that because of your particular risk profile, you don't need to have the pap at that visit, but it's very individualized for every woman. And so that's why the annual checks with your OB-GYN are important, so that he or she can tell you what you need to get tested for that year and what you don't. So that's very important.
Because cervical cancer is one of those cancers that, the symptoms, can mimic other things happening, correct?
That's right. So cervical cancer most commonly arises in women's reproductive years when we have periods, and that can make it confusing. Some of the symptoms, particularly bleeding abnormalities, can be confusing, but women tend to know their bodies. And so I always tell patients, listen to your body. If you know something is different about your periods, or you're having abnormal bleeding or discharge, listen to that and let your doctor listen to that too. So tell them about it in between those regular annual checks, because that could be an early symptom of a cancer, and it needs to be evaluated so that it can be caught and treated early.
And that's why it's so important to have a doctor that you have that one-on-one relationship with.
Right. These are difficult things to talk about. They can be embarrassing and sensitive, and so establishing rapport with a provider with an annual check will help you feel more comfortable opening up about some of these symptoms that are otherwise embarrassing to talk about.
Some good information this morning. Thank you so much. Cone Health is offering free cervical cancer screening starting next month and going through April. You can find a location that is close to you by calling 336-832-8000, or you can go to conehealth.com/screenings. And for more women's health services, check out conehealth.com/women.
House Call on Fox 8 is sponsored by Cone Health.